Hello, we're going to have a look at the Straumann bone level tapered implant line. We're going to have a look at some of the macro features, the micro features. We'll have a look at the potential indications or when you might choose to use this particular type of implant. And then we'll also have a view on how the implant is used from opening up in the box to actually placing it on the carrier, and then how we place it into the patient and some of the design features of that as well. So Straumann have essentially, on a basic level, two different lines of implants, and they have the tissue level implant, as they call it, and the bone level implant design. And then there are variations of those two macro designs. And the one that we're going to focus on at the moment is one that kind of maybe you could describe it as sitting in the middle of their current range. So you have the bone level range, which has the parallel sides, and then the BLX range, which has a more aggressive thread design, and then the bone level tapered range, which possibly you could call a cross between the two, and that's the one that we're going to be focusing on today. So the features of the bone level tapered implant: obviously it has no collar, so there's no polished collar on this, so it sits essentially at the bone level platform. So although this is termed a bone level implant, we do need to be cautious, and we're not automatically placing that in the level of where the bone is, because as with all implants, they should be prosthetically driven. So we need to look at where our emergence form is going to be, or where our tooth is going to be placed, and this then dictates where we place our implant. So we then might be looking at augmenting that bone. So we might be looking at possibly reducing the bone height if we have too much bone, so we can place the implant at the right depth. Or commonly, we may need to consider augmentation of the bone, whether that's GBR or whatever way we're going to do that, so that we can bring our implant to the correct level. So again, that we can manage our soft tissues and our prosthesis correctly. So that's always going to dictate where we place an implant. We're not sticking it at the bone level. So that definition of a bone level implant should be interpreted with caution. That said, let's move on to some of the features of this implant. So this is an implant that has an apical taper. So there's essentially a taper towards the apex of the implant. What they suggest with this is therefore we're able to change the direction of the implant once we've created our osteotomy somewhat. So there might be some sort of redirection of the implant if we felt that we needed to do that, or cautiously. We need to be careful, because although we've created an osteotomy, we may be able to move the implant away from that osteotomy. And if the osteotomy is in the correct position, then you need to be a little bit more cautious, possibly when placing it, in comparison to, say, a parallel sided implant, which is unlikely to deviate from the osteotomy. So that's just another precaution that we need to be aware of with this particular style of implants, and certainly with the implants that have a greater taper and more aggressive threads. We need to guide those in carefully, as long as our osteotomy is in the correct position, obviously. So some of the features of this implant is it comes with SLA, or SL active for Straumann surface, which is your sandblasted, large grit, acid etched surface, which is increasing the bone to implant contact by blasting that large grit sand and then acid etching the surface of the implant. We're not going to go into details in this video on that procedure, but look at the other videos that we produce for a little bit more information on how that's achieved and what that actually does to the implant surface. But essentially, it roughens it up so that we get more bone to implant contact and increases the stability of the implant and the time that it takes for the osseointegration, or the bone, to heal around the implant. And then they also produce the SL active surface, which was the aqueous solution, which makes the implant surface more hydrophilic, and therefore encourages, in basic terms, the blood and everything that comes with that. So those beautiful little bone growing cells to get closer to the implant surface, and therefore reduces the time that it takes for osseointegration to occur. And there is a beautiful little graph, and I'll try and put that up so that you can see that, where we can see the difference in healing times of an SLA compared to an SL active implant, therefore reducing the amount of time from a patient going from the stage of the implant being placed to the stage of the restoration being placed when an active surface is used. And there is plenty of evidence that actually back this up. And there are other implants that have similar characteristics and provide similar surfaces to their implant lines. And then we have the titanium and the rock solid aspects of this particular implant. So you have with these, they are a grade 4 titanium. So they're not grade 5, they're not alloyed with aluminium or vanadium. They are a commercially pure grade 4 style type of implant, as with all the Straumann line. And so you have the titanium line, and then you have the rock solid line. And with the rock solid line, what Straumann have done is they've used an alloy of 15% zirconium, and they've alloyed that with the titanium. So we've got a 15 to 85%, as long as I've done my maths correctly, alloy. And this is specific to Straumann. And this gives an added strength. So it increases the tensile strength, and also, according to the manufacturer, has better osseointegration abilities. What that means in terms then, if you're using or you have a need to use a narrower type of implant, you possibly might therefore consider the rock solid design to be a little bit more favorable over the titanium line, in the fact that you have that increased strength, and therefore potentially you have a low risk of implant fracture. So the transfer piece that Straumann have, it's called the Loxim, and rather than being screwed in, this has a very strong friction grip within the implant itself. So it's a sort of snap in, snap out kind of mounting. Makes it very easy to handle the implant. You're not having to undo any screws. So other implant systems may have a screw, which once you've placed your implant, you then need your little tool to undo that screw to take your transfer mounting out of the implant, which can be fiddly, can be difficult at times. With the Straumann implant, the way that works is, there's no pretty way of putting it, but essentially you give it a little jiggle, assuming your implant has good primary stability. And as you give that a little jiggle, then the transfer piece will essentially remove or snap out of the inside of the implant. It does have quite an ingenious little safety feature. So you'll see here, there's a little dimple just above the three little dots, and that has a safety feature that when you exceed 70 Newton centimeters, it could be 60, I think it's 70 Newton centimeters. Well, essentially what happens is it snaps. So when you over torque your implant, rather than potentially damaging, remember titanium's fairly soft, so rather than damaging the internal connection of the implant, the Loxim will essentially snap. That leaves you with the little part of the Loxim still attached. And if you look at the shape of that, you can see that your tool will still fit over that. So what you do is you have your tool, which will have the broken part in. You need some tweezers to remove that, and then you can fit that tool back over the remaining part of the Loxim, and you can use that. So you suggest you get your, if it happens, I suggest you get your hand wrench and start to back the implant out so that you're removing that pressure from the implant, and then either fully remove the implant and tap, or if you feel a bit more comfortable and you've just been a little bit excitable when you've placed your implant, then just start to re-engage your implant, and you can use the connection on the driver to measure your torque. So you shouldn't really feel the need to exceed any more than 30-40 Newton centimeters when you're placing these implants. Gives you good primary stability for pretty much all of your situations. The design of the Loxim also has these little dots, which you can see, and they're graded at millimeter increments above the implant platform. So you can see where your implant platform is, and then you can measure 1, 2, 3 millimeters above that, which then possibly gives you an indication of your emergence profile. Just helps you potentially assisting you with your prosthesis and understanding the depth of your implant and where your emergence profile might be placed. So it can be useful in certain situations. And then internally, with our prosthetic connection, we have that Straumann term the CrossFit connection, and that goes again with all the bone level tapered implants across the board. We've got that nice sort of 15-degree conical internal connection, which again is favoured across implants as being a nice, secure, robust connection with lots of evidence that we get success with our restorations long term in comparison to those implants that may not incorporate these features. With the internal CrossFit connection, we can see that we've got those various positions that we can locate indexed if we're using an indexed restoration in. And the principle behind this is essentially we get that sort of stronger resistance, and therefore we're eliminating any sort of screw loosening within our prostheses. I must say that I have had restorations which the screw still has loosened, but it's rare. It does happen. It's possibly because there have been either it's been torqued down, and when it's been torquing down, there's been some resistance, and that possibly is due to some resistance from the bone, so it hasn't been fully seated. Or there's been possibly some developing occlusal issues as the patient has gone forward and lost, or the occlusion has changed because the occlusion is dynamic. But I can't say as it's a huge problem, and I don't really see a huge amount of screw loosening across the implants that I place. But Straumann report that this actually practically eliminates it, or certainly reduces it. So what indications would you consider using the bone level tapered implant? Well, Straumann mentioned sort of soft bone, softer bone, or immediate extraction sockets. I've used it in a variety of situations, sort of type 2, type 3, type 4 bone. So I'm happy using this implant in many situations, not necessarily just softer bone and just immediate extraction sockets. So I do find this implant particularly useful. In terms of the size, I mentioned that a little bit earlier on. So the specific indications for those implants, and I think this is probably important, is that when you're looking at the 2.9 or the SC connection, you're looking at sort of, lateral incisors in the maxilla and lateral and central incisors in the mandible, potentially those sort of situations. Or you might consider another option, such as a bridge or a removable prosthesis, or doing nothing, obviously. And then moving up to the NC, the 3.3, then again you might look at sort of narrower sort of interdental spaces or narrower bone sort of situations. So you might feel that you can avoid potential augmentations by using that implant, or it might just fit a little better into your treatment planning. And then we move up then to the 4.1 diameter, and many indications in the mandible and maxilla. Very good functional aesthetic implant, and even in the edentulous or partially edentulous patients as well. Lots of situations with that. It's a very common implant that I have used and still use in many situations. Again, making your normal measurements, So, 1.5 millimeters from implant to tooth and 3 millimeters between implants. And again, that planning comes into it. So it's all about the planning and assisting that in selecting your particular implants. And then 4.8 RC connection, not one that I've commonly used, to be honest, but it's there, it's available, it's within the range. So you're looking at a minimal ridge width of about 7 millimeters on that particular implant. Remembering we like lots of bone around our implant. The more bone we have, the happier we feel. So probably more in the sort of the molar regions, and again, maybe if you felt that you had a larger dentulous space, pretty robust implant. Maybe not as bomb proof as we say the same diameter implant with a wider connection on top, or a wide neck connection on top, the SP line, and we can talk about that in other videos a little bit later on. You can see here bone level tapered implant, just looking at the box, see the size. We'll open the box up. So this is done by the non-sterile nurse, and then dropping the sterile component into a tray where it's not going to roll off. We can see the twist. So just identifying there all the markings telling us what the implant is, and we twist that off, and then we can lift this out, and that contains the implant with a lock sim, and then this fits into our transfer jig. And that's our rundown on the Straumann bone level tapered implant system. Hope you find that useful. Please like and subscribe, and look out for more videos about implants and other things. Thank you very much.